Welcome once again to 26 North Halsted. I'm your host, George Blaze. Are you feeling a little stressed out? I mean, I know if people watch this show, read the paper, everything going on with gas prices or global politics and issues, things going on here in the city. It's summertime. Are you feeling stressed out? Maybe in the office. Did they, when you got to the coffee machine, was there any coffee in the carafe or was it empty? That last person took the last cup. I know. It's building. It builds up. It has an impact on your everyday life. Whether you know it or not, stress has such an impact on our daily lives. That's what we're talking about today. Not only the triggers and the things that cause stress, but what it can do and how it can manifest in your body, and different ways you can think about dealing with the situation without resorting to just popping pills and necessarily going to the hospital right away. Joining me right now is Dr. Kris Tohtz from the Serenity Health and Wellness in Chicago. Thank you for joining us today.
Thank you, George, for having me.
Now, I came across your organization by going on the internet, as I do, doing research about stress relief and health and wellness in Chicago. Tell me a little bit about Serenity.
Serenity is a clinic that has been around for about 7 years. It's been down in the West Loop now for pretty close to 5 years over at 600 West Fulton. We're an alternative healthcare facility, so our focus is chiropractic, acupuncture, functional rehabilitation within the city confines for people to help augment their health, whether they're using medications or not using medications. We're all for improving and optimizing their life function as best as possible.
The vast majority of your patients, I would assume, have are dealing with situations where they've gone to other types of treatment and things like that, and here's something that they've caught wind of that they'd like to try, particularly when you're talking about alternative medicine. How do you, I mean, short of people referring other people to it, how do you attract people to even try or even think about alternative methodologies in terms of their health care?
Well, as I'm sure you know, with most physicians, people are usually looking for a word-of-mouth referral. They want someone that their friends know and that they trust. People do find us just within the neighborhood, but people also find us in line with their insurance company because they'll look for providers that are within their network. And probably for about 90% of our patients, chiropractic, massage therapy is definitely covered. Acupuncture, maybe about 40%.
Certainly within the last, I mean, in my experience, maybe 10 to 15 years, there's kind of been an uptick in the average person actually opening up to alternative kinds of treatment and alternative kind of medicines. You know, in your estimation, what has led to this, people being more open or more comfortable with trying these different things?
Well, I think there's a gap in what's missing within their lives, within their lifestyle, and they're realizing that, you know, that what they're having, whether it's IBS or neck pain or the effects that they're having and how stress is affecting them is not necessarily going to be fixed by a pill. Maybe they've tried antidepressants or anti-anxiety pills or any of that, but they've noticed it's more like a Band-Aid over a cut, that deep down inside they're not getting to the root of the problem. And I think that's where they start coming into looking for alternative sources for health care.
In a sense, you know, maybe we're kind of understating or oversimplifying things by just categorizing things as stress. Let's talk about stress.
Sure.
There are different kinds of stress. Some is positive, some not so positive.
Very much so. Short-term bursts of stress can be a positive thing. It's when stress becomes longer-term and more chronic that it can become problematic. I think the figures from the CDC were $300 million spent, or $1 billion spent on health care due to stress-related illnesses. So not just illness itself, but stress making illnesses worse. Stress is not just about the stressor, but it's about how the person perceives the stress.
Okay.
So their perception of stress, like, you know, you might find, you know, working 18 hours a day is a normal phenomenon, where the next person sitting next to you, 18 hours a day is more of a stressful thing for them. So it's not just the stressor itself, but it's the person's perception.
What you're personally kind of conditioned to, the circumstances and the environment that you're kind of conditioned to, or you know, if your friend is a carpenter or something like that and is used to working on the side of a building all day long, may not find that as stressful as perhaps I would find.
Exactly, yeah. They're like the window washers. That's a fine example.
I would find that very stressful.
Yes.
Tell me a little bit about the clients that come to you. I mean, are they all business people? I mean, we're here in the West Loop, so I assume it's a lot of people from this area.
There is a lot of people that are from the area. We do get a lot of business. We get a mix of blue-collar and white-collar people. So we do get construction workers, students, artists, Some reason, over the rash of recent things, I've had a lot of lawyers.
Really?
That have come in. Workloads are much higher now. People, because of the advent of computers and Blackberries and international business, they're never having any downtime. So the deadlines get, shortened up. The staff is getting cut because
Do you
of
find
the economy.
yourself a lot of times recommending to people that, hey, you know what, maybe you just need to slow down what's
Yes.
going on in your life? There's only so much I can do, as far as, being a chiropractor or acupuncture. You've got to make the change inside.
Very much so. And we refer people out for sure, for nutritional counseling, for Tai Chi, for yoga, for meditation, for breath walking. You name the source. Anything that's going to give them something to focus and compartmentalize their lives, because it's been shown in research and studies that meditation, Tai Chi, yoga, Qigong, things that help mentally calm a person down, make them more focused, thus making them more productive, so that they're better able to utilize their time more efficiently.
Well, Dr. Tohtz, I'm going to have you on in further episodes as we continue with this. If you want more information about the Serenity Health and Wellness, you can go to serenityhealthwellness.com. We're going to take a